Good morning, wherever you're joining us from. I'm Tom Spangler. I work as Activity Director for Save the Children for this IMPEL Associate Award. I think everyone on the call will know the purpose of IMPEL is to conduct both performance and impact evaluations and facilitate knowledge sharing to improve design and implementation of BHA-funded RFSAs. So either Terry or Mohamud can put in a link to a two-pager that gives a bit more detail on the IMPEL activity. But today's presentation will be led by Causal Design, who is among one of 5 IMPEL research partners. I think everyone here will know they have extensive monitoring, evaluation, research experience throughout sub-Saharan Africa and other parts of the world, including research with and for BHA. Today's presentation is going to be led by Sophie Turnbull of the Causal Design team. She may be joined by Enrico Campos or others from the Causal Design team as needed to respond to any questions that come up about the process evaluation. We ask that if you have questions during the presentation, that you post those using the Q&A function, not the chat. Causal Design will be stopping at different points throughout the presentation to respond to those. Since we have a relatively small crowd, I think we can do that efficiently. Today's presentation will be recorded, but only for IMPEL and BHA, and we won't be circulating or sharing the recording in any way. So with that, let me pass it over to you, Sophie, to get us started. Thanks.
Thanks. Well, thanks everyone for joining today. I think, most people know already about this, and most people know me, but I'm Sophie Turnbull. I work for Causal Design. I'm a MERL and qualitative specialist and have been involved with a few of these IMPEL projects that we have at Causal Design. So to dive into our agenda today, first we'll start off with a brief recap of the purpose and methodology of the process evaluation, and then dive into the findings, starting with the cross-cutting findings and recommendations, and then into the more intervention-specific finding and recommendations that we have. So starting with an overview of the methodology, and I will try and be relatively fast because I realize there's a lot to cover today, so I hope I don't go too quickly, and if I do speak too fast or anything, please let me know in the chat. So this diagram shows where the process evaluation fits in Causal Design's work with IMPEL. So we start with a baseline survey, which is purely quantitative. Then we have the process evaluation, which is purely qualitative. So the idea there is, the idea of the process evaluation is to specifically look at the implementation side of things rather than outcomes, because it's done in year 2 of the RFSA. So the idea is that this data will then provide information to support CLA efforts by the IPs and also provide context for the midline and endline survey findings as they happen. And then following from that, we have the midline survey and the endline survey, both of which are currently planned to be quantitative, but there may be a qualitative component to the endline survey currently in development. So looking at the process evaluation for PReSERVE specifically, as we mentioned, it's focused on implementation rather than outcomes or impact, but we do recognize that positive outcomes are a sign of successful implementation, so they are relevant in that way. It is purely qualitative, and as such, the scope has to be narrowed somewhat. So we focused on 7 selected interventions across PReSERVE's purposes and sectors. So these are the ones outlined on the right here. So the purposes, as a recap, are food security, livelihoods, and PSNP system strengthening. So the specific research questions of the process evaluation, first of all, they cover implementation progress. So to what extent have the IPs been able to conduct the work that they had planned to do? Successes in implementation and also obstacles. So this includes contextual factors as well as programmatic factors. And specifically, there are 3 contextual challenges that were raised during the design stage that we looked at in detail, and that was drought, inflation, and conflict, which have been prevalent in the implementation areas. And in addition, we have a focus on examining the inclusivity of gender and youth, as this is a focus of the PReSERVE program. So our deliverables include a process evaluation report, which has been finalized. I think it was finalized back in July. Then we held a CLA workshop, which is mostly intended for the IPs. So FH and other IPs, and also the USAID mission was in attendance. That happened. It was a remote a combination of sort of hybrid remote, mostly remote workshop in Ethiopia. And then finally, we have the stakeholder briefing, which is the meeting we have today. So the data that we collected for this process evaluation, they had quite a long span because there were significant delays due to the conflict. So it started in October 2023 and was wrapped up in February 2024. And the primary data that we collected was all qualitative key informant interviews, both with implementing partners and sector leads, mostly based at that higher level in Addis. And these were conducted remotely by Causal Design. But in addition, we wanted to speak to people throughout the kind of implementation chain. So we also had interviews with Woreda and Kibele level implementers, which were conducted in person by our data collection firm, Frontieri. And Frontieri also conducted validation exercises, which are basically, so although the data collection mostly focuses on implementers, the validation exercise sought to also get some inputs from beneficiaries themselves. So it kind of was a more flexible, informal tool with informal interviews and observation exercises with community members, also conducted by Frontieri in person. And so the table there shows the sample of the Kibeles and Woredas that we visited. So it's worth mentioning that PReSERVE is implemented in more than these 4 Woredas, but for sampling purposes, we selected these. And these Woredas and Kibeles were selected based in order to make sure there was representation across as many interventions that we were looking at as possible. So a few limitations and additional considerations to take into account when interpreting the PE findings. First of all, it is a qualitative inquiry. It's not a representative survey. There were also, and this is specific to the PReSERVE PE, there were significant delays and challenges with data collection due to the ongoing conflict in the region. So as such, we plan to do data collection in October, November of 2023, but ended up doing it in January, February of 2024. And something else to note, which we found across the various PEs that we've worked in, is that respondents tend to, even though they are implemented, they tend to focus more on outcomes rather than processes. So even though it wasn't the focus of the PE and outcomes are somewhat relevant to the PE, we tend to get a lot more outcome related data than process data. So, and similarly, some of the reflections were not specific to, although we selected 7 interventions, some of the reflections that people gave weren't super specific to individual interventions. I think in a lot of cases, respondents and IPs are involved in multiple interventions. And of course, with the cross-sectoral approach, interventions do speak to each other. So in some cases, it was a little hard to sort of pass out specific details of specific interventions, especially for some of the livelihoods interventions that overlap quite a lot. And the final note about the recommendations is that we do recognize that some of the recommendations that are provided may be challenging to implement or don't align so well with the focus on sustainability that the RFSAs have from year 3 onwards. So we hope that they still provide lessons learned for future resource allocation and program design. So moving into the cross-cutting findings and recommendations. Before we do that, I'll just add that depending on time, currently we have planned Q and answer breaks in between each kind of sector that we have. So we'll have one after these cross-cutting findings, but in the interest of time, we may decide to move all questions till the end, depending on how it goes. So the cross-cutting findings we have are related to contextual factors, which includes drought, inflation, and conflict, and then inclusivity related to gender, youth, and also linkages, which was not part of our research questions, but came as an emergent finding. So starting with drought, there were a lot of programmatic adaptations to drought, which was very heavy in a lot of the PReSERVE implementation areas. So some of the adaptations made were increasing emphasis on drought relevant topics during trainings, such as greater emphasis on water conservation and meal planning techniques. There was also a shift in inputs to more drought resilient or resistant crops. And another successful adaptation was a drought survey that was conducted by PReSERVE IPs in August 2023. And the findings of these produced in particular some very impactful visuals. So these were shared with the media, which helped to mobilize additional resources to combat the drought. In terms of disruptions to implementation, some of the key ways that drought disrupted implementation in a way that might ultimately affect outcomes was related to participation and migration. So some participants have migrated as a result of the drought, and also some participants have a difficulty focusing or prioritizing trainings when they're concerned with meeting other basic household needs. So overall, thinking about how the drought may affect outcomes in the final IE, the drought's effects on household productivity, assets, food security, and purchasing power are likely to impede some of the effects that might be seen. In particular, also, there are challenges implementing some of the lessons learned that participants may have heard during trainings. Moving on to inflation. Similarly, a lot of programmatic adaptations made to inflation. Some were quite successful. So, for example, the IPs implemented bulk purchasing plans to dampen the effects of inflation. They also released funds early in anticipation of further inflation to kind of counteract that ahead of time. And closer to the ground, there were also awareness campaigns conducted to educate communities about inflation and mitigation techniques, such as using locally sourced inputs, buying inputs in advance, also factors of meal planning and household financial planning, and so on. And also RFSAs so RFSAs being a local financial service provider who also provide livelihood-related transfers and loans. RFSAs also started to provide microloans as small as 4,000 birr or $70 US, not related to the livelihood component, but to help meet participants' purchasing power and their household needs. So in spite of these adaptations, there were significant disruptions to implementation. So, for example, the increased costs of inputs negatively affected budgets, supply chain related issues related to inflation also in some cases disrupted purchasing plans, and in a similar way to drought, migration and participation also affected. So related to outcomes, also similarly to drought, it's likely that the impacts of inflation are going to affect the outcomes that the IE might be able to detect with diminishing. And a key factor related to inflation in particular is that the credit for livelihood activities became less effective due to increased costs. So, for example, there was one anecdote about the cost of a transfer would originally have been able to afford 4 or 5 goats, but as a result of the inflation would only be able to afford participants to purchase 2 or 3 goats instead. So conflict was also very severe and affected many aspects of implementation. But many adaptations were made by IPs to try and counteract the conflict and be able to continue with implementation. So some phrases that kind of govern their way of operating include using every means possible under the new normal to be able to continue implementation. So some of the other mechanisms that were leveraged to be able to continue implementation were engaging with communities to be able to complete work safely, and also in a similar way, having close collaborations with government bodies, NGOs, and other partners was also cited as a critical success factor. There were also more ad hoc adaptations to community outreach. So, for example, conducting home visits where having large gatherings wouldn't be safe, having gatherings where doing home visits wouldn't be safe, and also relying on phone communications. So to really emphasize that there's a lot of resilience and determination among IPs to really ensure that implementation can continue despite the very challenging conditions. And this led to a lot of positive feedback and appreciation from RFSA participants. So despite these adaptations and efforts, of course, implementation has been significantly disrupted. So reduced access to areas has caused delays and disruptions in intervention activities, particularly on the monitoring and follow-up side. There have been supply chain disruptions, also linked to difficulties with movement and delays in financial transactions and credit transfers as well. And participation has also been affected when people are afraid of traveling, also due to conflict-related displacement, youth joining the armed conflict, and even deaths. So similarly to drought and inflation, the outcomes are likely to be heavily affected by the conflict and reduced implementation that's been necessitated. Moving on to our inclusion topics. So all interventions under PReSERVE have efforts or measures to ensure women's participation. So for example, in targeting women specifically, also in the recruitment of promoters and other IPs at the WREDA and Cabela levels. So overall, across interventions, it was found that women have been active participants, including in some cases in leadership roles. And women's participation in financial activities especially has increased over time. So there were also positive changes shared related to gender-related SBC messaging. So for example, changes in the distribution of domestic work, women's participation in the workforce, women's ownership of assets. But in spite of this, household responsibilities generally tend to continue to hinder women's participation across activities. And there are also continued limitations for women to assume leadership roles. So there's a quote there. In the interest of time, I won't read it now, but I'm sure the slides will be shared afterwards. So our recommendation related to gender inclusion is basically to continue gender mainstreaming and training across interventions to help increase some of the positive outcomes that have been seen so far. Moving on to youth, all interventions also have measures to intentionally engage young people. And youth participation is especially strong in the livelihoods related interventions, and especially youth employment, of course. So participants reflecting on inclusion of youth, the main strengths of youth that were noted were their kind of enthusiasm, energy, education, and modern outlook. And PReSERVE mostly targets out-of-school youth, given the time commitments that are required in a lot of interventions, but in-school youth are reached through some school-based clubs and activities, such as those organized under the Nurturing Care Groups activity. So respondents did recall, some successes in reducing youth unemployment and increasing youth capacity through trainings. And the validation exercise participants, the youth themselves, also reflected positively on the trainings that they'd received and the knowledge that they had gained under these trainings. So Rusakos, again, that's the local financial service provider, also reported that young people had successfully been repaying their loans. But in terms of the challenges, as kind of mentioned previously, some participation or attrition challenges due to the armed conflict, and also youth were more likely to migrate to cities in search of better opportunities. And another challenge was barriers for youth to access some livelihoods activities, and particularly loans due to a lack of resources such as land, collateral, or guarantors. So our recommendation on the youth side is to consider more options to make loans more accessible for youth. The linkages, I think, is our last cross-cutting finding, and then we can turn to any questions if there are any. So overall, respondents reflected very positively on the linkages that they had, both within the PReSERVE consortium and also between the PReSERVE consortium and between the IPs and other partners. So there's a multitude of stakeholders involved in the PReSERVE program, which includes government of Ethiopia, stakeholders, private sector partners, financial institutions, other NGOs, UN agencies, and generally people reflected very positively on their ability to collaborate with other partners. And collaborations were also cited as key success factors for implementation progress to date, and also outcomes that had been seen. So more specifically, some of the benefits of cooperation that were voiced by respondents were the ability of cooperation to help increase community buy-in and also for resource sharing. So for example, this quote here, a health extension agent recalled that the collaborations have helped to give them credibility and acceptance within the community. I'll pause there if there's any questions and discussion. I didn't see any in the Q&A, but I wonder if anyone has any question that they want to come off mute and join in.
Can I just jump in with a very, very quick question? I think it's not going to take so much time. The point you mentioned on inflation, of course, inflation is affecting everybody, but I have a feeling that many partners have actually been benefiting from the exchange rate gains now, which would offset the loss on inflation. So I don't know if that balanced or if one is too strong than the other. Thank you.
I can't say that any of our respondents had any positive reflections like that. It could be that because our data collection wrapped up in February, it could be that since then that may be a factor, but I'm afraid in our data we don't have any indications of that.
Okay, just a follow-up question. I'm sorry about that. Is you have mentioned that the risk scores has gone down to 4,000. Can you clarify that?
Yes, yeah. So this came up in the CLA workshop as well. So to clarify, the Rusakos mentioned that they have started to offer loans as low as 4,000 birr, but that was it was not directly related to the livelihood transfers interventions. It was more related to providing loans for people for other means. So, for example, to meet household needs or have smaller business ambitions and things like that. Does that help to clarify?
Yes, thank you.
No problem.
Thanks to Shomai for those questions. Yeah, any others, do please feel free to come off mute. Or I see a chat from Carl on the text, but any others who have questions, please do feel free to come off mute and pose them yourself.
So you did talk about linkages and you talked about loans for the youth. Did you find any linkages for probably VSLAs, Rusakos with MFIs, microfinance institutions or banks? Because those are the linkages we are also looking at. The youth can also benefit as well as community members who can't have any lending from the VSLAs can also go upwards for loans. Has that been happening?
That may come up when we speak more about the youth employment intervention, but I'm not sure if we had that much nuance. I can look back into the data and see if we can disaggregate a bit more between the different types of loans people are getting or the different loan sources that people are getting. But I think in some cases people were kind of speaking quite broadly when they spoke about the youth taking loans and the youth paying back their loans. They didn't necessarily specify which source they were taking them from. But I can look back into the data to check that out and follow up with you.
Okay, just in general on the linkages, were there any link? You spoke of linkages with the government and other stakeholders, but were there any linkages related to the market?
Yes, we have some information about that. So and we'll get to it more in future slides. So in some cases, there were some anecdotes of successful market linkages being created, for example, for people to sell agricultural inputs. But more significantly, I would say people were recalling difficulties because of conflict-related transport and access challenges, which were sort of impeding market linkages from being created. So I think some of these questions I think will be answered a little more, and happy to revisit them once we've sort of covered some more of that information. So maybe in the interest of time, I'll just move on, and we'll have more question and answer breaks as well. So starting with the intervention specific findings. So we've broken these out by purpose. So starting with purpose 1, which is about food security. One of our interventions was the irrigation intervention, which consisted of the construction of hand-dug wells, small-scale irrigation, water harvesting structures, and also agronomic training. So overall, irrigation was cited to be proceeding on schedule and per plan, especially given the contextual challenges. So speaking of linkages, the government of Ethiopia respondents we spoke to were very positive about PReSERVE support, particularly related to reallocating budgets, especially given the competing priorities that the government had to combat the drought and the conflict So collaboration with communities was also cited as a vital success factor for construction activities, particularly clear roles and responsibilities between IPs and community members. And irrigation activities were well received by participants, particularly given the drought context. And some recalled seeing positive outcomes on harvests as a result of access to irrigation. And in terms of women and youth, there was also a lot of intentional participation by women and out-of-school youth for these activities, including some specific accommodations made to be able to include women. So, for example, having different starting and end times for women to attend construction activities due to their competing household responsibilities. So moving on to some of the challenges. Some respondents did note that they felt there was a limited capacity to do all monitoring of all Kebeles while also addressing operational issues as they arise. So it's difficult to continue to maintain monitoring activities when also trying to fix a particular structure and things like that. Some also recalled that there was limited enthusiasm or participation in trainings given the absence of a per diem. So this was mentioned in this intervention, but not across all interventions. So another few respondents also mentioned competing priorities. So the fact that emergency relief activities tend to take precedence over these irrigation activities, which are have a longer time span. There were also some issues with structural damage at the start due to drought and flooding. And some respondents also emphasized a need for continued needs for maintenance of old structures. Some of these structures were built during the previous DFSA, and as a result needed maintenance which hadn't been accomplished yet. So, for example, one of the factors that was mentioned was there was no fencing around it, which was perceived as a safety concern. And some of these maintenance and construction activities were paused due to the conflict. So our recommendation there is to the extent possible, assess the feasibility of resuming or increasing monitoring and supervision activities, possibly using remote means. And just to flag also that that's quite a recurring theme across lots of interventions, given the challenges conducting monitoring activities due to the conflict and access challenges there. So moving on to our next intervention, which is nutrition sensitive agriculture, which consisted of activities related to keyhole gardenings and also fruit seedlings. So again, effective coordination with stakeholders was mentioned here and cited as a success factor. And agriculture and health extension agents who were trained as part of this intervention were very positive about the training that they received. So in this case, where it had been possible to conduct, a key success factor was cited to be rigorous monitoring and comprehensive ongoing training to follow up with participants and help troubleshoot issues as they came up. So the validation exercise where we spoke to beneficiaries, beneficiaries also reported high satisfaction and also in some cases reported positive outcomes. So for example, changes in food security, nutrition and maternal health, and also increasing agricultural productivity to have surplus yields beyond consumption alone. And so being an agricultural activity, some drought-related adaptations were necessary. So some successful adaptations that were reported by participants included emphasizing crop diversification, water conservation, and food preservation and meal planning techniques. And an adaptation to inflation that was also cited as positive was emphasizing using compost as a substitute for chemical fertilizers for participants. So in terms of the challenges, drought, hail, crop diseases, and pests were cited as challenges that could affect yields. Inflation and drought were also cited as challenges to implementing behavior change that was promoted under the activity. So, for example, although promoting the consumption of animal products was one of the lessons from the training, some of the livestock and poultry deaths due to the drought could impede that from happening. There were also conflict-related supply chain disruptions, I should say, which limited the availability of seeds and fertilizers for participants. So one participant also recalled that this led to using a lottery system to distribute fertilizer in a fair way. And also some respondents, particularly in Sahila and Simada, also noted a need for increased organizational capacity and coordination with government partners. So while these are large across interventions, most reflections are very positive about this. In this case, a few respondents in Sahila and Simada noted that there was sometimes a gap in joint supportive supervision, for example, and also challenges coordinating with government partners related to their different conflicting other commitments. So our recommendation for this intervention was to continue strengthening partnerships and communication across partners to address these coordination gaps. Moving on to nurturing care groups. So NCG discussions, so this intervention consists of having discussion sessions and also home visits with participants. So NCGs had the participation of a range of different types of women, so including pregnant, lactating women, young women, adults, married, unmarried, which was managed by providing different sessions tailored to specific needs and the different needs of these different groups. And it was in the NCG's intervention that we saw most women taking on leadership roles, which is not surprising given that it's a very female-focused intervention. But men were also included in this intervention through cooking demonstrations, home visits, and also gender outreach groups. So the outcomes were also, some positive outcomes were also noted as a result of applying NCG teachings in some cases. So improving feeding practices, exclusive breastfeeding, hospital births, and also reduced maternal mortality. And similarly to one of the previous interventions, follow-up visits were cited as a critical success factor for reinforcing that behavior change. So this very long quote here from a health extension agent, just highlighting that participants receive personalized attention and guidance, enabling them to better understand and apply the principles of nurturing care in their daily lives. This individualized between knowledge and action. I thought that was a good quote to help reiterate the need for continued follow-up trainings to help promote these behavior changes across interventions as well. And health promoters and health extension workers also reflected positively on the trainings that they'd received and also the training materials, particularly the visual training materials. So similarly to other interventions, drought-related food and water shortages could be a barrier for implementing some of the nutritional learnings. And inflation also affected participants' purchasing power, which could affect their ability to follow nutritional learnings and also make contributions for food demonstrations, and could also impact attendance at trainings when people have to focus on meeting basic needs as opposed to attend trainings. Conflict and road blockages also affected the IP's ability to access communities and conduct trainings. And despite some positive changes and positive behavior change, it was noted also that there is a persistence of some social norms, such as early marriage and fasting of pregnant and lactating women. And some IPs also requested additional learning aids for participants, particularly given the success of the ones that they had received previously. So our recommendations there related to those last 2 points are to continue awareness raising and engaging religious leaders for social behavior change on the importance of balanced diet for pregnant and lactating women, and also consider providing additional training materials to IPs who are traveling to Kibeles, given the effectiveness of some of the other visual aids that are provided. So that brings us to the end of our Purpose 1 interventions. You see there's a couple of questions in the Q&A. How do you supervise an irrigation activity remotely? I'm not quite sure. I imagine it's something to do with, I think this was discussed in the CLA workshop, and it would involve having community members also sending photographs of irrigation structures, so that then they can be sent to teams elsewhere to sort of look at the photos and see if they have been damaged and things like that. I hope that helps to answer that question. I think FH may have, in the CLA workshop that we held, there was some action plan templates and documents that I can share with everyone to see if some of these questions might also be elucidated a little more in those documents. And can you provide any comment on keyhole gardens as a nutrition activity? For example, are people consuming anything produced from the gardens year round? I'm not sure I can say. I'm not sure our data spoke to whether the sort of sustainability of, or the, whether or not the keyhole gardens were being used year round. I can check the data as well to see if there's any more information about that specifically, but it's possible we didn't dive too much into that because the focus of the PE was intended to be focused on process rather than outcomes, but it's possible that the end line might also be able to give some more information about that. And will we be able to determine if NCG leaders were doing counseling discussions or were they primarily doing messaging? So your recommendation focuses on awareness raising, which sounds like messaging. This gets into the quality of NCG implementation. I'm not quite sure. I can look back into the data on whether it was more sort of counseling and discussions or messaging. To that. I think, yeah, in a similar way to some of the recommendations we had about gender in general, it's about the recommendation is kind of geared towards the positive outcomes that have been received and sort of emphasizing that. So maybe changing some of the specific messages to target some of those behaviors that are not shifting so much. I hope that answers the question. All right, great. Thanks, Taka. So moving on to the livelihoods interventions. So the first intervention that we looked at was the livelihood transfers, which consisted of cash transfers, business development, and also technical and financial training. So those were overall noted to be proceeding smoothly with trainings proceeding and also funds being distributed successfully to participants despite contextual challenges. Similarly to other interventions, the feedback system and consistent follow-up was an important success factor there. And there were also some positive outcomes noted on economic well-being and livelihoods that participants were able to make as a result of transfers. So participants reported that they'd been able to make investments in animal husbandry, repay debts that they had, and also meet their household needs. So youth and women's participation was also concerted efforts to increase participation of youth and women. So women were very much present in Rusakos and Visas, so village savings and loan groups. And in terms of the challenges, inflation, of course, undercuts the value of loans and therefore the intervention's ability to improve financial well-being. There were also conflict-related disruptions. So for example, the inability so Rusakos weren't able to deposit collected repayments at banks due to insecurity on the roads. And as mentioned before, some persisting limitations for youth to access finance due to a lack of collateral. And we'll talk a little bit more about this in one of the following interventions, but there were also some concerns related to the capacity and organizational constraints among Rusakos, and some persisting limitations as well on women's participation due to cultural norms and expectations around household responsibilities. So a similar recommendation there to continue SBC efforts to encourage women's financial access. Moving on to the second livelihoods intervention that we examined, which was value chains. So this included commodity-specific support and also promoting access to finance. So again, trainings and material distribution were proceeding well, given the circumstances, and participants interviewed were satisfied with the effectiveness and the relevance of trainings. So some reported successes using Rusako credit services, also agricultural sales of yields for value chains promoted under the intervention, and also livestock breeding successes. So Some successes also in facilitating market linkages, both for participants' outputs and also for necessary inputs. And positive reflections also on the coordination between different stakeholders. So this involved a lot of different stakeholders, including financial service providers, training providers, so successes there. And also in gender-related SBC and women's participation. So some of the key measures to increase women's participation were specifically targeting married women for value chain interventions and also providing joint spousal credit opportunities. And specifically the value chains intervention, specifically targeted unemployed out-of-school youth for these opportunities. So some challenges, although women's participation was stronger than expected, it did continue to be limited due to domestic responsibilities. And as mentioned before as well, youth face restrictions in engaging in certain value chains, given their access to resources such as land. The inflation also, in addition to the other challenges related to inflation, IPs also noted that it presented a challenge for accurately projecting financial needs. So on the kind of project management and planning side, inflation caused that challenge. And as mentioned before, some capacity and structural gaps around RFSAs were noted. So this quote here from a respondent helps to illustrate this. There are some skill gaps and there are some structural hurdles that are not suitable to be used by our participants. So, and another point there is what respondents in two WREDAs also expressed concerns about the capacity for monitoring and supervision at a Kibele and WREDA level. So this was more of a manpower related challenge. Not enough people on the ground to be able to conduct all monitoring and supervision per the plan, which could limit the ability to address challenges in a timely manner. So our recommendations on this were to continue efforts to engage and include women and youth, and also assess RFSA's capacity to deliver intended services and provide necessary support. The youth employment, which is our last livelihoods intervention, was also reported to be well underway, a lot of overlaps with the other interventions, other livelihoods related interventions. And the effective linkages between partners was cited as a key success factor here. And similarly to before as well, some evidence of successful market linkages being established for accessing land, input, and financial services. And youth participants interviewed were also positive about the training they received, which included on-the-job training and also per diems. So the training was seen as extensive, practical, relevant, and effective. And the training also included technical, business, and also soft skills topics. And so the youth employment included both men and women. So in terms of the challenges related to youth employment, most of them were related to exogenous factors. So some of the contextual factors that we mentioned before, conflict, drought, and inflation, but also migration and drug use among youth. So some respondents also noted a need for additional oversight and monitoring in order to optimize the effectiveness of the implementation, as monitoring and oversight was currently impeded by the conflict. So one respondent here noted last year there was a lack of follow-up activity upon field visits. We found that approximately 15% of clients weren't participating due to inadequate follow-up. And a few respondents in Lega and Simada also noted a need for additional support and particularly manpower to assist with participant selection, which was currently only being done by a team of one person. So they were worried that they were concerned that this lack of manpower would limit the number of participants that it was possible to recruit or mobilize. So our recommendation here is to consider additional support for participant selection. I'll skip over that and move on to our final intervention, which is related to Purpose 3, PSNP systems, and specifically the DRR committee, the support for DRR committees. So that's disaster risk reduction committees at the community level. So respondents reported that selection of committees and training of the committees had been proceeding largely as planned. And again, very positive about collaborations and partnerships with stakeholders, which included FH, other NGOs, government of Ethiopia bodies, and also UN OCHA across all levels. So Woreda, Kibele, and throughout. So the DR committee members also shared examples of successful linkages, and particularly related to data sharing that they had been able to do as a result of the PReSERVE intervention. So, for example, facilitating links for data sharing, sharing data about vulnerable households from the community level to Woreda offices to inform planning and participant selection, and also early warning to be able to disseminate early warning information. So as intended, the DR committees were found to include women, youth, and people with disabilities. And one successful drought adaptation that was noted by a DR respondent was mobilizing a 5% commodity reserve by FH, which was able to be leveraged to provide assistance to households in the drought. So some of the challenges related to the DR committee's intervention, some respondents noted that the budget was constrained, which limited the ability to conduct preventative activities, as all of the activities all the budget had to be forwarded to response activities. And the conflict also created challenges to maintain consistent service delivery, monitoring, and participation. So, for example, there were difficulties mobilizing community members to conduct collective works. And also an additional finding that came out of the CLA workshop was that some DR committees had also ceased functioning or had paused their functions due to the conflict targeting political actors. And DR committees, being a government body, obviously contain actors such as the Kibele chief and other sort of authorities who might be targeted by armed groups. So similarly, there was on the flip side, there were also respondents who noted a need for increasing the kind of organizational capacity and formality of DR committees and incentives for DR committee members to help encourage their participation and their activities. And although women were part of DR committees, their roles in leadership were limited, which was attributed to systemic issues in government recruitment processes for DR committees, as these are the government has rules about which actors take on which roles, which therefore limits the ability of women to necessarily assume leadership roles. So our recommendations there, in our report, we suggested to consider some form of remuneration for DR committee members in order to encourage their participation and motivation. And during the CLA workshop, another recommendation that was discussed was to consider alternative organizations to conduct DRR activities. So DR committees also liaise a lot with other CSOs on the ground. So it's possible that some of these CSOs could take over when DR members are not able to conduct activities. So I'll pause there for questions and discussion. Let's do a time check. We have about 5 minutes left.
Sophie, I'll come off mute and ask, because I don't know if are there any additional questions in the, I think Carl and I asked this at the same time. I wanted to, before you go to Carl's, I just wanted to ask, so this evaluation for PReSERVE is looking at the marginal impact of the livelihood deepening package on those households that are participating. And so I wanted to get a sense from you, based on this process evaluation, what is your sense on the interventions that are contributing to those outcomes? Are they being implemented well, so that when you guys do the midline and the end line, we'll have confidence that, okay, these interventions were implemented well, and the results that were the findings, the impact is a good measure of the value of those interventions? And I don't mean value from a cost perspective, but just in terms of their ability to influence. Do you understand my question? I think I kind of rambled a bit trying to get there.
I think I do.
Okay.
So you're basically asking about, is the implementation proceed from this process evaluation? Does it seem like implementation is proceeding in a way that the IE will be able to meaningfully answer? Being able to meaningfully assess, the ideal implementation of these activities as planned. At the moment,
Yeah,
my
in the sense of like, we won't say, oh, there wasn't much impact. It might be because the interventions weren't implemented well, right? We wanted to be able to say there wasn't much impact and we know the interventions were implemented well, or there's a lot of impact and we know the interventions contributed to that. Over.
Mhm. Sure. I mean, I think one of the biggest findings that we realize is the extent to which the conflict in particular affects how interventions are able to be implemented. So in these, in the implementation plan for a lot of these is, repeated follow-ups and monitoring and things like that. But there's been a lot of effort, a lot of effects on participation. So people's ability to even attend trainings due to, fear, migration, and having to focus on basic needs. And also, implementers' ability to travel has been very much compromised. So it sort of depends on how implementation is able to progress in the next coming months. Obviously, this is halfway through. Our data was collected halfway through the intervention, so it could be that the situation calms and implementation is able to proceed more as intended. But yeah, I think conflict will have a significant impact on the ability of actors to have conducted activities exactly according to plan. Does that help answer your question?
I mean, it does, but then I guess like I guess maybe just need to think about it, because if I think if we're going to blame things on conflict, then it's going to just raise a lot of questions in terms of what we see at Endline. Over to Carl's question.
Sure. So does the LO, the quote, refer to M&E or technical monitoring and support?
Sophie, that might go back a little bit to
Mhm.
Mara's question around effectiveness of implementation. So it just kind of triggered my curiosity.
Sure, I'm not quite sure I understand the question. If you wouldn't mind explaining it a bit, thank you.
Well, I mean, in a lot of our projects, not just PReSERVE, but we have, significant investments in training. But then is there, I thought he captured that very well. Is there associated follow-ups and support, and are they systematic? Because this would be like going to college for 2 weeks and having a lot of stuff dumped on you and then going back and trying to implement it. If you were, say, a lead farmer or some sort of livelihoods community extension agent of sorts. So, is that goes back to the question of implementation. Is there good implementation? Is the implementation effective, I guess? Because I think a lot of times when we say monitoring, that's become a separate thing from, say, a technical approach, for lack of a better word.
Yeah,
Sorry.
I know what you mean. No, I agree. I think monitoring, obviously, in this space, we often think of monitoring as in its relationship to M&E, but the way IPs talk about monitoring is often about, following up with participants and, visiting households that attended trainings and seeing, giving them personalized coaching, checking if they are able to implement, lessons learned and things like that. And I do think something that we can certainly continue to check in on also as part of if we do a qualitative approach to the Ethiopia RFSAs, we can certainly ask more about this at the end of the project and assess more, to what extent, now the project is the bulk of implementation is over, how much really did it diverge from the intended plans to conduct supervision and monitoring activities, and how is that kind of affected? Because one of the other main parts where monitoring was able to happen, it was definitely cited as a really critical success factor, and really helped to encourage participants to take on lessons learned and ask questions if they had it, and also feel that there's that there's, more engagement and more buy-in that way. There's here a quote here: supervision accompaniment is often neglected. We rely heavily on cascade training, unfortunately. I think even the cascade training, that lowest level of so I think most of the lowest level implementers are at the Kibele level. So they're then responsible for doing those follow-ups, and just follow-up from anyone is seen as so valuable and helps to create that buy-in and encouragement. I hope that helped to answer that question as well.
Thank you very much, Sophie. Just noting that we are at time. If there are any other questions, please feel free to come off mute and pose them yourself. Otherwise, thank you for joining today. We can give it another minute. Any additional questions?
I'm also available after this for about 15 minutes or so I can stay on for any extra questions.
Yeah. Just one, maybe you don't necessarily have to respond to this, but the issue of monitoring, we are really concerned about, from BHA side, we are concerned about the monitoring aspect, because obviously, except for WAG Hamra, no senior person has gone up to the field. Nobody's monitoring the activity. PReSERVE is saying that they are monitoring using remote mechanisms, but we don't really know how effective those monitoring mechanisms are. So the inability to do monitoring at field level from the more senior people in the headquarters in Bahar Dar, we don't know the impact of that. So I was hoping that you might shed light on that when you are, not necessarily not necessarily now, but that's probably at some stage.
Yeah, certainly. Yeah, we can certainly raise this as, we can incorporate this, for example, if we're still in the development of deciding how the qualitative inquiry as part of the impact evaluation is going to look, but we can certainly consider that as a research question, and possibly I'll have to speak to Miguel, who's our survey expert, more, and I wonder if there'll be a way to maybe incorporate into the survey some kind of question, for example, about, like how many times were you reached by a field agent, or how many times were you visited by a health extension worker or something like that. So maybe we can try and assess that a little bit more and find out about the link between how drastically monitoring activities were affected, and then also how does it affect the ultimate outcomes of the program. So yeah, thanks for sharing that. We'll bring it forward and hope to be able to incorporate it into the end line. Thank you.
Okay, thank you. Yes, thank you very much for the questions. Thanks for your thoughtful responses, Sophie. Thanks for an excellent presentation. As you said earlier, we can and will share this presentation slide deck. The full report is complete and will be posted on the FSN network very soon. If anyone has questions about today's presentation before then, please do be in touch either with IMPEL or with Causal Design directly. Thank you all for your time. Have a good rest of your day.
Thank you very much, everyone. Bye, everyone. Thank you.